ਪੀਲ ਰੀਜਨ ਦੇ ਵਿੱਚ ਬੀਤੇ ਕਈ ਦਿਨਾਂ ਤੋਂ ਕੋਵਿਡ-19 ਦੇ 100 ਤੋਂ ਉੱਪਰ ਕੇਸਿਸ ਦਰਜ ਕੀਤੇ ਜਾ ਰਹੇ ਹਨ। ਬ੍ਰੈਂਪਟਨ ਮੇਅਰ ਪੈਟ੍ਰਿਕ ਬਰਾਊਨ ਨੇ ਬੀਤੇ ਦਿਨੀ ਸਿਟੀ ਦਾ ਕੋਵਿਡ-19 ਅਪਡੇਟ ਦਿੱਤਾ। ਇਸ ਦੌਰਾਨ ਵਿਲੀਅਮ ਔਸਲਰ ਹੈਲਥ ਸਿਸਟਮ ਦੇ ਪ੍ਰੈਜ਼ੀਡੈਂਟ ਅਤੇ ਸੀਈਓ ਡਾਕਟਰ ਨਵੀਦ ਮੁਹੰਮਦ ਅਤੇ ਪੀਲ ਰੀਜਨ ਦੇ ਇੰਟਰਮ ਮੈਡੀਕਲ ਹੈਲਥ ਆਫਿਸਰ ਡਾਕਟਰ ਲਾਰੈਂਸ ਲੋ ਵੀ ਖਾਸ ਤੌਰ ਤੇ ਹਾਜ਼ਰ ਰਹੇ।
I'd like to begin today by thanking the provincial government. We had a great announcement yesterday with Premier Ford, Minister Elliott and Prabmeet Sarkaria announcing 41 new beds for Brampton Civic Hospital, as well as a commitment, and this was music to my ears from the Premier, to get shovels in the ground and get our hospital built, phase 2 of Peel Memorial. And so that's the second time we've heard that public commitment for what is an essential project for the city of Brampton. This announcement comes at a time when it's needed more than ever. COVID puts pressures on the healthcare system, and given the inequities in healthcare funding we see in the province, this recognition by the provincial government was an important one. In January of 2020, our Brampton City Council unanimously passed a motion to declare a healthcare emergency in Brampton because of the unique and urgent needs of this rapidly growing city. Brampton has about 55% fewer hospital beds per person than the provincial average. While the provincial average is 2.19 hospital beds per 1,000 people, in Brampton it is 0.96 per 1,000 people.
Osler is receiving funding for 87 additional beds across our sites, 41 of which will be at Brampton Civic. With one of the busiest emergency departments in Canada, this investment is critical as we continue to serve Brampton's growing community and provide care to more COVID-19 patients as we enter the cold and flu season. At this time, there are 27 patients that have COVID-19 at Brampton Civic, and 6 of those are in the ICU. These new beds will help us address capacity pressures, prevent hallway medicine, and support our healthcare teams to deliver the high quality and compassionate care as we anticipate higher than normal patient needs this winter.
For everyone else beyond that, as hard as it is, assume that they may be harboring the virus. Everyone, no matter how long you've known them or how well you know them. Letting someone get within your 2 meters is exposing yourself to everyone that they may have interacted with in 2 meters within the last 2 weeks. I cannot stress more. For in-person gatherings, cancel, postpone, or meet virtually if you can. And if you must meet for an essential reason, such as work, school, exercise or fitness, healthcare, or purchasing food and drink, gasoline, or automobile maintenance, strictly follow the precautions of 2 meters of distancing, masking, and hand washing. I am also calling on places of worship in our community. While recognizing that modified Stage 2 restrictions are silent on your venues, I am urging, as much as possible in this second wave, to consider a return to virtual or online celebrations where possible. Secondly, industries that cannot do work remotely remain a significant driver in Peel. Most of our employers have taken precautions, but some have not. I urge you to ask, is your company doing all that you can to protect your staff and your community?